Claire, you're from United Lincolnshire Hospitals NHS Trust, and you're going to talk to us about the Doctor Will See You Now. So we're fascinated and teased by the heading. I'm going to hand straight over to you. I'm on hand. I'm going to come off the camera, but I'll be in the background looking for questions, and I'll come back in towards the end.
Yeah.
Over to you.
So, thank you. Thanks, Shane. So at ULHT, due to COVID and prior to COVID, we were looking at how we could bring in video consultation to help with our rural locality and also to help reduce our carbon footprint and also to reduce travel for our clinicians and also for our patients. So I have got a short video that hopefully will give a flavour of what we've done. Fantastic.
That's it, Jenny. Okay, so Jenny, you've got that from your desktop. Claire, is this a video that plays that we've got sound with?
It did have sound, but I can talk to it. So basically, the aim was to reduce the outpatient attendances of footfall. And so we implemented the Attend Anywhere starting at the end of March, and to utilise it across every specialty, and so that we could actually ensure that outpatient attendances weren't impacted by the COVID pandemic. It doesn't seem to be. So, as I said there, there's an opportunity to also look at our current outpatient services, ways of redesigning them, reducing the footprint, and also removing travel time, not just for the patient, but also for our consultants as well. We have 4 sites across Lincolnshire, and the travel between the 4 can be difficult because we don't have much in the way of motorway here in Lincolnshire. At the end of each outpatient video, there is consultation. There's a survey that we ask our patients to fill out. What you're not hearing here is what the patients think. So up to now, we've had patients embrace it. As it says, it was a fantastic idea. They're not having to bring small children in. They're not having to take time off work. And it also means that people can actually still go on holiday. So even though people weren't in Lincolnshire, they were able to have their appointment from Cornwall, Scotland, anything like that. So it actually did help. And with us being a student, with us being a university city, it's also helped maintain contact with some of the students that are under our care. So unfortunately you can't hear the sound on this, but as you can see, patients are finding it very useful. We have also had issues. Some patients wish to be seen, and so we've taken that into consideration while we've been factoring in video consultation. So also some patients are still being seen face to face if they need a treatment or if they need to have a visual examination by a clinician. So as it says in there, we've had over 4,000 video consultations. We've had over 5,500 hours of video consultation time, and we've now had over 1,000 respondents. People are finding it more convenient, they're finding it less stressful, and even those who initially were apprehensive about using the technology have found that the technology, once they've got used to it, have embraced it and have enjoyed it and would prefer to continue having video consultation where possible. So again, on that slide, it just shows some of the quotes that have been taken from the patients and the benefits from the patients. 94% would prefer to continue, and the time spent was quite interesting. So 48% saved an hour, 42 between 1 and 2, and 10% over 2 to 3, which when you're only in consultation for maybe 10-15 minutes. It's a huge saving for the patient. Our clinicians, 71% wish to continue to offer video consultation. 47 have found it useful because they're shielding. So on this slide, we've said no going back, and we want to make video consultation the default modality wherever it's clinically appropriate. We're now working with system-wide colleagues to maybe get one approach to the delivery of patient appointments, so that a patient, if they need something, is seen just on one system. We've learned stakeholder key engagement is key. ICT was a key stakeholder and a key enabler to get all this working. Make sure we have the right patient in the right clinic has helped reduce complaints and concerns. Unfortunately, this bit, the feedback from clinician, is spoken, so you're not going to be able to hear what Mr. Sapsabel had to say. However, he's our clinical lead for outpatient services, and just reiterates what's already in the presentation to date, that clinicians are embracing it. Although they found it a bit difficult at first, they are now finding it easier and find it's actually making the consultations smoother, and also helping them to get through some of their PPWL and their outstanding patients. It's also enabled them to work from different areas. So for those that are having to work from home because of illness or shielding, they're still able to continue and feel still to be part of the team. So from a UHT perspective, there is no going back. And like I say, the doctor will see you now, and they like video consultation because they get a feel for the patient. They get an understanding of the patient's surrounding, but also sometimes patients on the telephone can be maybe not as honest, or they may say they're well, they may feel that they're well, but the clinician from video can pick up if something is maybe a little bit awry and bring them in for the next face-to-face appointment that they have available. And we've found it works really well in multidisciplinary situations. We have a cystic fibrosis clinic, and we've had 7 clinicians all reviewing the same patient at the same time. And that has saved travel for the family and for the clinicians. And it's also meant that decisions can be made there and then. We've also had other situations where family members have joined from different parts of the country and been able to take part in a decision over definitive treatment for family members, which in light of COVID, when the patients are unable to have anybody with them, this has made it really beneficial in some situations. And also the family then get to hear firsthand what the clinician is saying to their friend, family member, and it has cut down from anecdotally on the amount of follow-up phone calls that the admin staff receive. So it has proved to be a really beneficial enhancement of our outpatient services. It had its challenges, and it would be remiss of me to say that we haven't had the challenges. One of the main challenges was the availability of webcams and headsets, because as we were looking for them, so is the rest of the country. But we're now in a position where every specialty, we have 49 waiting rooms, we have 720 registered clinicians, and we're averaging around about 2,000 to 2,500 appointments a month. We'd really like to up that, but it's been a case of getting it moved forward. It's been used by Macmillan, the Macmillan Cancer Support Service use it to be able to reach out to the patients and patients reaching to them. And community midwifery have said that have found it really beneficial as well. And we're hoping for community midwifery they'll continue to use it, although once they can start getting their hands on the ladies again, that will probably be more in their way of thinking. But for the remoteness of our county and for our patients, we are definitely going to continue with this and take it forward.
Claire, thank you very much indeed. It's brilliant to hear the effect the changes have on people's lives. So being able not to have to physically make those journeys. One recognises, I'm a father of 4. I mean, thankfully, I've got one teenager and the rest are in their 20s now. But we had 3 children within 15 months. You can imagine for 10 years trying to take them anywhere. I didn't have enough arms physically. So, but also being able to continue with your life, the people who were able to get away from home. But also bringing in those other services like the cancer services and the third sector and what have you. What an absolute fantastic transformation. We have a question from Alison, and she says, where patients have said they don't want to take part in virtual sessions, are there any themes around why?
Yeah, there's some of them that don't have the technology. Some of them don't feel they would rather be seen face to face because that's what they're, not saying that they're used to doing, but they feel more comfortable doing that. And we do have some parts of the county where the broadband and the Wi-Fi isn't good enough. And so we are looking at ways at how we can maybe do something differently. And there's been discussion around using GP practices, stuff like that, just to try how we can make it easier for the patient. But ultimately, it's patient choice. And if they don't want to be seen by video, I've got a colleague who went, oh no, I don't want to do that. And so we can't force them, although it is our preferred modality, that we can then do telephone or if needs be to video, to face to face.
Brian Donnelly's asked a question, and a really helpful one. Are multidisciplinary consultations available? Do you have that facility?
Yeah, so we've used it in cystic fibrosis, like I said during the video, and we've also used it for the diabetic foot clinic because our dietitian needed to be shielded. So the patient was coming in and we were using the technology within the hospital by using an iPad. So the dietitian could still see the wound. The vascular surgeon was in the room talking to the dietitian, and so the care could still take place. We're using it in community midwifery for linking up with mental health services for women during pregnancy. And we're also using it in cancer. So the specialist nurse and the oncologist can then, if they link independently, once oncologists is finished with their discussion, they can leave the conversation, but the specialist nurse can still continue and support the patient. So we're looking at it in a variety of ways, but also to make it as beneficial for the patient as possible. Yeah. But definitely, with Attend Anywhere, I think the most we've had consultant or clinician-wise has been about 7 to 1 patient.
Wow. That's phenomenal.
And we're also now using it in teaching because obviously students can't be in close proximity with the consultants. Now we're working with the Graduate Medical Centre, and we're having the, with the permission of the patient, the student joins the consultation. So they're still getting the experience. And next week, a patient has kindly agreed to be seen by a group of rheumatology students being supervised by the rheumatology consultant, but the students are going to lead the appointment with the patient. So again, teaching can still take place, and it just means that we're not losing momentum because obviously we still need our junior doctors coming through.
Yeah. And I mean, that's absolutely fantastic examples of, the speed of the adoption. I mean, yes, it was born of necessity, but I mean, I think you've demonstrated there, one, how quickly it can be done. And at the end of the last session, I asked both the clinician and the supplier, where do you feel this may land after? We were heading for a very difficult 6 months, probably. The take up by your colleagues has been phenomenal. The take up by patients has been phenomenal. But as you pointed out, some people just need face to face, and it's not easy. So where do you think we'll land it with this in the future? Because I think one of the strange byproducts of this pandemic is that actually something's become more efficient. The ability to see people faster has actually taken place quite a lot. Now, that's not always an easy thing if it's still virtual, but how do you think things are going to pan out?
I think this video will become a part of the suite of how we see patients. I mean, one of the interesting things with the pandemic is everyone assumed that the older generation would be the least able to actually use the technology. And to be honest, I would disagree. I think they've embraced it because they've been using it to see their grandchildren speak to their families. They're used to using it now. So they are happy to use it. I think it will just become part of the norm in the way that in how we start to see our patients, going forward. And especially for rural counties, snow, we often get quite, a bit of snow here, that stops people travelling, but if it doesn't stop the consultation and then doesn't impact patient care.
We had some earlier examples today about the savings in cost, in time, and often people say, it takes an hour to get to and from the hospital. Actually, though, there was a lot of people have to take the day off to go with loved ones, and so regularly as well. And there is an anxiety. I found myself, taking loved ones to hospital. There's an anxiety about actually getting there, making sure they're comfortable, and those things. Hopefully, what we've done is a bit of a step change. I'm going to say thank you so much. Alison's got one final point. We're up against time. I think it's a really good point because we found the exact same assumptions. The older generation wouldn't use it, but they've adopted it really well. I know, my own family in their 80s found it easier to adopt things sometimes than I have. Although I think having a good 11-year-old or thereabouts is usually a really good thing to do with technology. I say that humbly as a CEO of a technology company. Claire, it's been fascinating having you this afternoon. Thank you so much for taking the time, and I'd like to thank Sharon as well for helping put us together. So, look, thank you very much for your session. I'm going to